The newsday continues here on One News Now. I'm Riza Diaz. The Health Department reports over 3,000 new COVID-19 cases for the third consecutive day. That brings the country's total caseload to more than 594,000, around 36,000 of which are still active. Nearly 95% are mild and asymptomatic cases. The virus claimed the lives of 51 more patients in the past 24 hours, bringing the death toll to more than 12,500. Now, some 545,000, meanwhile, have gotten better from the disease, with over 10,500 new recoveries reported today. The Metro Manila Council is looking to review the current quarantine policies across the capital. To share more about that, we have on the line Navotas City Mayor Toby Tiangco. Sir, good afternoon.
Yes, good afternoon.
Sir, MMDA Chairman Benher Abalos said he was set to meet with NCR mayors yesterday. Did that push through, and can you tell us about the key takeaways from the said meeting?
Yes, natuloy po yung meeting namin kahapon. Actually, napakahabang meeting yon. It started at 4 p.m. Among the Metro Manila mayors, then 5 to almost 8 p.m. No? Mga 7:50 o 7:55 na yata kami natapos. Metro Manila mayors naman with the DOH.
Sir, ang MMDA po ay nagbigay ng report that isolation centers in Metro Manila are now at 89% capacity. Sa inyo po ba sa Navotas, ano po ang status ng quarantine facilities?
100% capacity na po kami sa Navotas sa mga quarantine facilities na.
Sir, meron po ba kayong mga nakikitang loopholes in the current COVID-19 protocols that we are implementing? And ano kaya ang pwede natin gawin to address these issues?
Number one, kailangan talaga makita yung ating mga mamamayan. No? Because like in Navotas, ang nakikita namin is number one, napakabilis ng hawaan. Number two, ang pinakamabilis na hawaan is within the household. No? So, kung within the household, hindi naman natin mabantayan yung mga tao within the household. So, kailangan talaga dyan is makita yung ating mga kababayan. Pangatlo, alam naman natin, okay, for example, galing siya sa bahay, bago siya makadating sa place of work niya, o bago siya dumating sa opisina, dadaan muna sa labas ng bahay niya, dadaan sa iskinita niya. Doon sa loob-looban, doon madaming hindi sumusunod ng mga health protocols. So, kailangan talaga doon sa loob-looban, stricto ang pagtupad ng health protocols. Dahil kung hindi, bago siya dumating sa opisina niya, madami na siyang nahawaan or nahawan siya. So, yan po ang pinakamahalagang pagtuunan ng pandemya.
Mayor Tiangco, what about the decision of further reopening businesses? Ano pong inyong masasabi dito?
What specific business kaya?
Let's say the reopening of cinemas, yung mga iba po nating mga leisure activities. Ano pong masasabi niyo po dyan?
Yung cinemas at saka yung gaming arcade na pag-usapan niya ng Metro Manila mayors, and majority want it deferred.
Okay, maraming salamat po.
Because of the surge.
Maraming salamat po sa inyong oras.
Thank you.
That's Mayor Toby Tiangco of Navotas City. Meanwhile, health experts and scientists around the world are monitoring the development of COVID-19. What do we know so far about the various variants and mutations of the virus? Let's watch this video from the World Health Organization.
Today we'll be speaking about the evolution of the SARS-CoV-2 virus, which is the virus that causes COVID-19. Here to answer our questions is WHO's Dr. Maria Van Kerkhove. Welcome back to the show, Maria.
Thanks for having me.
Maria, what is the latest information on the SARS-CoV-2 variants?
WHO with partners are currently tracking 3 virus variants of concern that are circulating around the world. The first is the B.1.1.7 that was first identified in the United Kingdom. The second is the B.1.351 that was first identified in South Africa. And the third is the P.1, which was it's circulating in Brazil, but it was identified among travelers arriving in Japan. We are tracking changes in the virus and what this means in terms of transmission, severity, and impact or potential impact on diagnostics, therapeutics, and vaccines. So far, the information that we have is that there is increased transmissibility in the B.1.1.7 and the B.1.351 virus variants. And this is resulting from a mutation that allows this virus variant to bind to the cell, the human cell, more easily. We do not see an increase yet in transmission with the P1, but that is currently under investigation. In terms of severity, there are some studies from the United Kingdom that suggest that the B.1.1.7 has increased severity. There are studies that are underway that are evaluating the effect of vaccines against these virus variants. And from the information that we have so far, the vaccines still work against these virus variants.
Maria, what can people do to protect themselves against the SARS-CoV-2 variants?
There's so much that you can do to protect yourself against the SARS-CoV-2 virus, including the variants that have been reported. It's all about the individual level measures: physical distancing, hand hygiene, wearing a mask, respiratory etiquette, opening a window, avoiding crowded spaces, staying home if you're unwell, making sure you get tested if needed, following the local advice where you live. We have seen in a number of countries where these virus variants are circulating that transmission is being reduced with the use of these measures. And this is really critical. We have had many global consultations and meetings to look at these virus variants and determine if any changes are needed in our guidance. And so far, with all of the information that we have, the public health and social measures, the infection prevention and control measures in healthcare facilities and outside of healthcare facilities work against these virus variants. Take all of the steps that you can to keep yourself and your loved ones safe against SARS-CoV-2.
Meanwhile, here are other stories we're keeping our eyes on. President Duterte started doling out nearly 20 million worth of projects for barangays that are confirmed free of NPA presence. The budget will be used to build farm-to-market roads, classrooms, health stations, irrigation, and provide electricity. A consumer group files complaint report against the Social Welfare and Trade Departments for failure to comply to act on calls to draft guidelines for online discounts for PWDs and senior citizens. The report filed before the Anti-Red Tape Authority says the government failed to provide a public consultation on the discount guidelines, even if the motion has been filed since October 2020. And heads up to motorists, expect a rollback in gasoline prices this week. Diesel prices are expected to be reduced by 40 centavos per liter, while gasoline prices will go down by 10 centavos per liter. This comes after 4 consecutive weeks of price hikes. Now, for more updates, visit News 5, The Philippine Star, and Business World Online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. We are One News.